Hello, this video will cover documenting chief complaints in HPI and Scribe. We'll start off by taking a look at how to document the chief complaints. You would start by indicating the section you want to populate, in this case, chief complaint, and dictating the punctuation colon. You'll then say new line to move the cursor down. Let's take a look at how this is done. Complaint colon. New line. Headache. New line, abdominal pain. Once completed, you'll click Scribe. You'll note that information populates into the progress note. It's important to be aware of a few things. The colon and line after chief complaint are both required. Without them, the dictated chief complaint as one line will populate into the chief complaint section. This is true of every section in the progress note. HPI is going to be somewhat more complicated, and that's mainly because there are many approaches in doing so in eClinical Works. Let's take a look. The first scenario is the easiest. The physician is dictating the HPI as a narrative in the HPI notes section at the bottom of the HPI screen. With this scenario, the documentation will populate in the default category that you specified in your setup. Let's take a look at how this works. HPI, colon, new line. Patient presents complaining with chest pain, period. Patient is also complaining of abdominal pain, period. Dictated in, you'll once again click on Scribe It. When we take a look at the progress note, we'll note that our category has been chosen here. And when we navigate into HPI, you'll note that the Notes section at the bottom has been populated. You'll also note when it was dictated in, we went ahead and specified the section of HPI, and it was followed by a colon and a new line. Also notice that the review of systems has been captured in that scribe command as well, and this is because on certain keywords, Scribe knew to populate that section. This automatic population can also be turned off in your settings. The second scenario will involve populating the notes field next to symptoms. This is probably best done using Dragon or any Clinical Works template. We won't get too much detail on the configuration, but we'll use already created. Let's take a look. HPI colon, new line. Pulmonology colon, new cough colon, productive, new line. Wheezing colon, none, new line. Shortness of breath colon, worsening. Once you've entered in your information, once again, click Scribe It. As we take a look at the note, you'll see that information appear in the HPI section in the notes section next to the symptom. So if we actually navigate into HPI, you will see the category we've navigated on into and the various symptoms that we documented our notes for. The last scenario involves using the complains of, denies approach. This will populate the relevant symptoms with the findings. Keep in mind that I'm using the same structure, progress note section, then category, subcategory that applies, and then the symptoms. Also, each of these symptoms has to exist as an item in each subcategory for this to work. Let's take a look. HPI colon, new line. Off under pulmonology colon, new line. Patient complains of sore throat, comma, wheezing, comma, denies cough, period. And once again, we'll scribe it to populate the HPI section. Let's review what was done in that second scenario. Once again, I'll click on last text to display what we entered. You'll note that it starts with the HPI, and on the line below is the category. Cough is the subcategory, and finally you have a line that comprises the symptoms and the findings. This structure mimics the exact one seen in the normal progress note view and is responsible for Scribe knowing how to populate the HPIs well. This approach works the exact same way with the examination, review of systems, and any section that contains progress note categories. To get a visual representation, once again we'll navigate into the HPI section, and you'll note that the items that the patient are selected and the items that we indicated the patient denies have a check mark under the denies column. That concludes this video. Thank you for watching.